ئەوەدان کە پێویستی تاکەکانی نەخۆش و تاکەکانی پێویست بە چاودێریەکی باشتر لە ناو کۆمەلگادا چارەسەر بکەن. ئێمەش وەکو یەکێتی ئافرەتانی کوردستان وەکو ڕێکخراوێک کە دێرینترین ڕێکخراوە لە کوردستاندا هەمیشە لە پاڵ ئەرکە سەرەکیەکانی خۆمان کە باسکردن و وشیارکردن و ناساندنی ئافرەت بە مافەکانێتی کە ڕۆڵێکی کاریگەر لە ناو کۆمەلگای کوردستاندا ببینێت. ناساندنی پێگەی ئافرەتە کە ئافرەت دەتوانێت لە ناو کۆمەلگادا چ ڕۆڵێک ببینێت و هاوسەنگی پاراستنی نێوان پیا و ئافرەتە لە ناو کۆمەلگادا بەڵام لە خەمی تاکەکانی دیکەی کۆمەلگاشدا بووین. بۆیە لە پاڵ کارە سەرەکیەکانی خۆمان لە پاڵ بڵێن بەردەوام داکۆکیکردن لە مافەکانی ئافرەت زەمینە ڕەخساندن بۆ بەشداریەکی کاراتری ئافرەتان شیاندنی ئافرەتان هەمیشە هەوڵماندایە کاری خۆبەخشی و کاری هاوکاری لە ناو توێژی ئافرەتیشدا پەرەی پێ بدەین. هەموو ئەو بڵێن بیرۆکە هەڵانە کە بە شێوازێک لە شێوازەکان دراونەتەوە پاڵ ئافرەتان بە هەمان شێوە لایان ببین. یەکێک لەو خاڵانە ئەوەیە کە لە ناوتوێژی ئافرەتدا زۆر باوی هەیە ئەوەیە کە خوێنبەخشین بۆ ئافرەت تەندروست نییە. زۆرینەی ئافرەت نابێ خوێن ببەخشێتەوە بەڵام ئێمە ویستمان ئەو بیرۆکەیەش لە ڕووی زانستیەوە کە ئێوە لە من شارەزاترن و ئافرەتیش هەوان شێوەی پیاو دەتوانێت ئەگەر تەندروستیەکی باشی هەبێ و ڕێژەی خوێنەکەی تێدا باش بوو دەتوانێت خوێن ببەخشێتەوە. بۆیە و هەروەها لەبەرەوەی کە ئێمەش وەکو کۆمەلگا هاوشانی پیاوەکانی کە بتوانین و بە تایبەتی کە ئافرەت دایکیشە و دڵی دایک هەمیشە بۆ مناڵەکانێتی بە حەقیقەت زیاتریش لەم ڕوانگەیەوە هەوڵماندا کە هەڵمەتەکانی خوێنبەخشین لە ناو ئافرەتەکانیشدا ڕێکخەین. بۆیە لە ساڵ 2013ەوە بەردەوام ساڵی جارێک دوو جار بە تایبەتی لە شەڕی داعش بەدواوە بەردەوام هەوڵمانداوە کە هەڵمەتەکانی خوێنبەخشین ڕێک بخەین و بە تایبەتی لە ڕۆژێکی وەکو ئەم ڕۆژدا کە ڕێژی جیهانی خوێنبەخشانە دیسان دووبارە وەکو یەکێتی ئافرەتانی کوردستان ئەمڕۆ سەعات 11 بەیانی هەڵمەتێکی خوێنبەخشینمان ڕێک خستووە بۆ ژمارەیەک ئەو ئافرەتانەی کە توانای خوێنبەخشینیان هەیە و هەروەها ئەو هەستەیان تێدا هەیە کە بە بەخشینی دڵۆپێکی خۆیان ژیانێکی دیکە ڕزگار بکەن. من زیاتر درێژەی پێنادەم دەستخۆشی لە ئێوەی بەڕێز دەکەم. هیوادارم دیدارەکەتان سەرکەوتوو بێ ریسێرچەکانتان جێگەی ئەوە بێ کە لە ڕووی زانستیەوە لە پێشکەوتوتر. من زۆر سپاس بۆ ئەم دەرفەتەیەش کە بۆ منتان ڕەخساند و وەکو یەکێتی ئافرەتانی کوردستان هەمیشە پاڵپشت هاوکاری سنتەری توێژینەوە و فێرکردنی تەندروستی ئافرەتان دەبین بۆ ئەوەی کە پێکەوە بتوانین خزمەتێکی زیاتر پێشکەشی کۆمەلگا و خۆشەویستەکانمان و تاکەکانمان بکەینەوە. زۆر سپاس بۆ ئازیزان.
زۆر مەمنون. سپاس دکتۆرە ڤیان بۆ ساپۆرتی بەردەوامی جنابەت بۆ سنتەری ئێمە و بەڕاستی کەسێکی کارکتەرێکی دیاری لە خزمەت ئافرەتانی کوردستان. دەستت خۆش بی. زۆر سپاس.
سپاس بۆ ئێوەش.
We will go to our first presenter, Dr. Hunar Omar Dilpak, Medical Director of Directorate of Blood Bank in Erbil. He will present for us about the women and blood donation data from Director of Blood Bank Erbil. Please, Dr. Hunar, over to you.
Well, Bismillah ar-Rahman ar-Rahim. Good morning, good morning, all participants. Thanks for this great opportunity.
Do you have file to share, Doctor?
Yes, yes. I'm just trying to.
Yes.
Well.
Yes, it is okay, Doctor.
Okay, so thank you. Thank you for this opportunity on this great day, which is the World Blood Donation Day. And I would like to say greetings to all our valuable blood donors. Because of the shortage of time, I will start directly. Well, my presentation is about our data of the availability of females or women for blood donation in Erbil, in the center of Erbil, according to our data in Directorate of Blood Bank in Erbil. So first of all, happy World Blood Donor Day. As you know, as a definition, blood donation or blood transfusion, or the importance of blood donation. So blood transfusion is a major part of healthcare management all over the world. In modern medicine, it is a major part of the healthcare. Because patients in all branches of medicine, including surgery, medicine, gynecology, obstetrics, hematology, oncology, pediatrics, even now plastic surgery, all the branches of medicine, they are in need of blood and blood products or blood components. And they need the transfusion to improve the clinical condition of the patients or to save their lives, for example, in emergency situations. And there is a word that worldwide, in every 3 seconds, a person is in need of blood or one of the blood products. So just to imagine how blood is important and how blood donation is important. And that's why the WHO announced this particular day for blood donors. And it is the birthday of the Austrian physician and scientist Karl Steiner, who discovered the ABO blood group system in the early of 1900 or 1901. So the only source of the blood and the blood products which is needed for these patients, as I mentioned, in all the branches of medicine, the only source is healthy blood donors. So till now, we don't have a substitute for the normal, the natural human blood. There are some sources of artificial blood, but they are never like the blood donors' blood or human blood, and they are very available everywhere. So we always say that the donated blood is a gift from the heart. So when a donor donates his blood or her blood, it is a gift from the donor's heart to the patient. And of course, without blood donors, all of the healthcare system will be paralyzed differently. But unfortunately, until now, generally in our community, we don't know the value of blood donation and the importance of blood donation. Even the authorities, they are not so familiar with the importance of blood donation or blood donor care, or in general, blood transfusion services all over the country, all over the world. Well, so we always say that every blood donor is a hero. Even if somebody decides to donate a unit of blood, I will regard him or her as a hero, because he or she will save the life of at least a person or a patient, and maybe 2 or 3 persons, because the donated blood will be separated into blood components, which are the red cells, the platelets, plasma, and sometimes we will treat with precipitate from the plasma. So 3 to 4 lives will be saved by a single donation. Now, just going to our data about female blood donors in Erbil. Actually, I don't know what to say. The data is shocking. The data of 6 years, I will present the data of 6 years, 2015 to 2020. Why from 2015? Our blood bank established in 2012 and became functioning at mid-2013. But we will start to receive all the blood donors in the center of Erbil from 2014, half or mid of 2014. So that's why the data of 2014 and 13, they are not the total data of blood donation in Erbil. Our data for 2015 includes all the donated blood in the center of Erbil because our directorate is the only donation center in Erbil. So in 2015, the percentage of female donors was only 0.8. So it never reached 1%. It never. 0.8 and coming down until, as you see, in 2019 and 20, 0.25% and 0.23%. Actually, it is a very low number in comparison to other countries, for example, to Europe. That's, I read their data about 50% to 50. So female to male donors 50 to 50. But here, as you see, our data never reached, for the last 6 years, never reached 1%. What are the reasons why? I will, in my opinion, I will discuss some of the factors behind that. Well, is it okay to go to pass this slide?
Yes.
Anyone want to look at the data, or it is okay? I can pass.
Yes, you can pass, I think, this. And
Well,
so we will see that during the last 2 years, it is very diminished, the number of.
Yes.
Yes.
Yes. Yes. I will tell you why. In the last, for example, in the last year, apart from the Corona pandemic, there were other reasons also related to the Corona pandemic. But I will tell you, inshallah, why the data is like that. So, in my opinion, the factors behind these low numbers is the availability of the female as blood donors. They are not available. And I say that it is because of cultural factor. In our community, usually men are in the front line. For example, in our locality, unfortunately, till now, the types of blood donation is still 2 types. We have voluntary blood donors and family replacement or replacement blood donors, which are now about 50-50. So the donated blood are 50% from voluntary donors, and the replacement is 50%. What is the replacement? For example, a patient needs blood. We will ask the family or relatives or friends of that patient. We will give or issue the blood, but we will ask for replacement of that blood, especially for the negative blood groups. So during that replacement, when the person goes and seeks for blood donors, he will never bring female blood donors, never bring ladies from the family, always looking for the men. So this factor is affecting the availability of ladies as blood donors. Another point that the donation from women is usually on occasions. For example, universities. For example, today is World Blood Donor Day. Some organizations or some ladies, they will arrange a small campaign or come in small groups of 5 to 10 persons, ladies, to donate their blood. So once a year, some of them will come for donation. And usually others, I mean ladies, they will donate during the outside donation campaigns. For example, our donation campaigns in the universities, in the institutes. There are already females, students, females. They will try to donate there also. But most of them will be deferred because of some factors, for example, physiological factors. We will not accept a lady in the menstrual cycle as a blood donor, or we will not accept a pregnant lady as a blood donor. Even after pregnancy for 1 year, the lady cannot donate blood. Or, as we know, females, they have lower hemoglobin level as male. Again, because of this factor, some of these ladies who wish to donate blood, they will be rejected or deferred because of the borderline low hemoglobin level. So in the last year and last 2 years, because of the Corona pandemic, we couldn't arrange any outside donation campaigns. So not any campaigns in the universities. Usually every year we go to every college or university in Erbil. We have a specialized mobile donation unit. It's a specialized, a big car containing small donation beds can move to everywhere. And the staff will go with this mobile unit and they will collect blood for those who wish to donate in their place, for example, in the university, the college, or
دکتر تنها یک دقیقه ما اگر
تمام اوكي یک سلاید میام یان کمتر. So in my opinion, these are the factors behind the low numbers of female donation, and what to do to correct these low numbers or to increase donations among females. We need to establish a national organization for blood transfusion services. This should be controlled nationally, and we need blood law. We don't have any blood law. It should be legislated by the parliament blood law. We need national policy, national standards, and guidelines about blood donation and blood transfusion services. And we need community and public education on the importance of blood donation through media workshops or flyers, conferences, or anything else. And these all need infrastructure and human resources, and of course, budget. And thank you very much.
Thank you very much, Dr. Hunar. Thank you for accepting our invitation and present here. Thank you very much for your nice presentation and this data that we can work on it. Thank you very much, Dr. Hunar. Our next speaker is Dr. Delir Qadir Galali. He is assistant professor, physiologist, and head of physiotherapy department in College of Health Science of Hawler Medical University. He will present about the physiology of blood donation. Please, Dr. Delir. Did you stop, Dr. Hunar, your?
Yes, please.
Yes, thank you very much.
Thank you.
Dr. Delir, dengi mate? Awa atun kirda co-host, Dr. Delir.
اوكي دست خجو ميوت كرام لو قصاشم ذاكر دايما دات
ولا اتون دوباره او کرد بس دیاره در چوبی.
اوكي بسم الله الرحمن الرحيم. سرتا دست خوش تاني دكم دكتور بو سازاني او سيمبوزيوم. Good morning, everyone. I will start my presentation under the title Physiological Effects of Blood Donation. Okay. دكتور سلايد كان شير وزح.
نعم. لا شير نياكاي.
اوكي.
استخري كالشير ده بقى.
استقبل الوعد. شير ويا دكتورة.
بله فرم.
Okay. As mentioned, the title of my seminar or topic is Physiological Effects of Blood Donation. First, I would like to take an overview about the history or starting of blood donation. In 1665, the earliest known blood transfusion was started. In 1795, the first human blood transfusion was done by Philip Physic. In 1818, first transfusion of human blood for the purpose of treatment of hemorrhagic patients was done by Dr. James. In 1840, The first successful whole blood transfusion to treat hemophilic patients was done by Samuel Armstrong. In 1900, the first IBO system, or the IBO group system, was identified by Karl Landsteiner, an Austrian scientist. And at that time, he named the IBO system A, B, and C. And after that, the C is changed to O letter. O here doesn't mean letter O. It is 0. Why? Because it doesn't contain any antigens. In 1902, Alfred and Adriano, who are the friends or co-worker of Landsteiner, add the fourth blood type AB. In 1907, Hecton suggests that applying cross-matching blood between the blood, donor and recipient blood will be developed or improve, will success the blood transfusion. Moresky describes the antiglobulin reaction. In 1940, long-term anticoagulants are developed, like sodium citrate, and this step allowing the longer preservation of blood. In 1932, the first blood bank is established in Leningrad Hospital. In 1939, or between 1939 to 1940, the RH blood group system was discovered by Landsteiner, Weiner, Levin, and Stetson. Okay. About the history of World Blood Donor Day, it was first organized by the World Health Organization in collaboration with Red Cross on June 14 in 2005 for the purpose of raising awareness of the need for safe blood and blood products, as well as to appreciate or thank blood donors for their voluntary life-saving gifts of blood. The theme of World Blood Donor Day. Each year, WHO decides on a theme for this day, for this special day. The theme of this year, 2021, under the slogan, "Give blood and keep the world beating." It highlights the importance of donating blood and how it can save people's lives around the world. Blood donation refers to, if we simply define the process of blood donation, we can define it as, it refers to the process of collecting, testing, preparing, and storing blood with all its components. It can vary based on the type of donation, because we have several types of blood donation. We have plasma donation, platelets donation, red blood cells, and whole blood, which is the most common blood type donation. During and after a donation, those components, I mean by the components of blood, can be separated to give a recipient exactly what they need according to the condition. Now we are coming to the calculation of the human blood cells in a pint of blood. Average adult has 8 to 12 pints, on average mean 10 pints. Each pint equals 0.4. If we calculate the pint to cubic millimeter or microliter, we can say making blood donation uses 1 pint of blood. It means when a person donates a pint of blood or a blood, it means what? It means he gives 1/10 of his or her total amount of blood. Normally, each microliter of blood or cubic millimeter of blood containing, I mean by normal conditions, containing 5 million red blood cells in microliter, it will be about 2.4 trillion red blood cells in each pint. Regarding the white blood cells, each pint contains 3.3 billion white blood cells. Each pint contains about 1.3 billion platelets. Once a person or a donor gives his or her blood, it means he or she gives all these numbers of blood cells. Now we are coming to what happens to our body when we donate blood. Short-term impact on the day, on the body. In the day after a donation, red blood cells are replaced at a surprising rate. Why? Because bone marrow will be stimulated and receive the message that overall HO2 levels are lower inside the body. Why? Because of the loss of high amount of red blood cells. And as well as bone marrow has increased the output of stem cells, which eventually become either red blood cells, white blood cells, or platelets in a process named hemopoiesis or hematopoiesis. The immediate impact on the body as a result of donating a pint of blood is a loss of red blood cells. It takes a number of weeks to replenish those stores. This is why the donors must wait between two donations. بورا دكتور نازم دنگم ديتن تكلامي من هيتسونيا.
بله زور واضحة.
اوكي.
اقعد لوقتت بدو دقة ما.
والله بدو دقة استنى قلت دكتور. اوكي. In the short term, a minority of donors may experience lightheadedness, fatigue, or nausea due to the iron and water loss related to the sudden absence of blood components. But this will quickly pass as stores are replenished. To minimize any adverse reactions, it is important to prepare for the blood donation by eating iron-rich meal and drinking plenty of fluids. This is prior to blood donation. While after blood donation, you will also want to replace fluid immediately and to keep the body well nourished. Long-term benefits of blood donation. Studies reveal many possible benefits of regular blood donation. Most of blood donors are less likely to suffer a heart attack. Why? Because donating blood helps blood flow, giving it a lower viscosity. It decreases the viscosity of blood. Decreasing viscosity of blood means what? It takes or gives rest to the heart, and thus making less damaging of blood vessels. Blood donation also helps regulate iron levels in the body. Too much iron can be damaging the blood vessels. A regular decrease of iron-rich blood and subsequent replacement due to blood donation can lead to a more beneficial lower iron level. Your body or our body will replace the volume or the blood volume, I mean by plasma, within 48 hours. It will take 4 to 8 weeks to completely replace the lost red blood cells. And you will not notice any physical change related to the pint you donated. Okay. Now we are coming to the how long recovery takes. After a standard donation, a person often sits and relaxes for about 15 minutes. The donor can drink water, juice, and can snack to help prevent or address any fatigue or dizziness. When the person feels ready, within few hours, they can return to most of their usual daily activities. What to do after donation? Donating blood lowers levels of key nutrients of body by eating and drinking certain foods. A person can eating iron-rich foods can help replenish levels of the mineral in the blood. It is a good idea to eat foods rich in the vitamins, especially vitamin C and vitamin B. What to avoid not to do after donating? Donating blood usually does not affect a person's daily routine, as we said. However, it can limit what a person can do immediately afterward. The loss of red blood cells causes less O2 circulating in the body. As a result, a person should avoid very hard activities or very strenuous activities right after donation. طبعا هم دزانين blood donating كارشي لروي عينيو هم بيروزا هم كارشي مروفاتيا. الوقلاتي بيروزا ومن أحياها فكأنما أحيا الناس جميعا. And there is a quotation, remember that the happiest people are not those getting more, but those giving more. And thank you.
دست خوش کای دکتر دلیر قادر جلالی for thank you very much for your nice presentation. Now we have a short video about people opinion regarding women blood donation, which is prepared by Ms. Shahnaz Mohammed, instructor in College of Health Science. کای دکتر اگر شیرکت لابی
لامدا دکتور لامدا.
Okay. It is very short video, so I have to find it. Where is it? Just a minute.
وڵاتی ئێمە وا باوە کە پیاوان خوێن زیاتر دەبەخشن وەک لە ئافرەتان بۆ چوونی تۆ چێ دەربارەی ئەو شتە؟
زاگەر چێشت بۆ دوستنێ بۆ تەندروستی نەبێت چێشە نیێت.
یعنی ئامادەی ئەگەر بێت
خوێن ببەخشم بەوانەی کە پێویستیان پێیە.
باشە ئەگەر بێت و لە دوای تەمەنی نائومێدی کە با بڵێن سووڕی ماگانە ڕادەوەستێت ئەگەر بێت و بتوانی خوێن بدەی ئامادەی بیدەی؟
ئامادەم بەڵێ.
ئەی باشە ئەو هۆکارە چییە کە پیاوان زیاتر خوێن دەدەن وەک لە ئافرەتان؟ ئەوە شتێکە ڕێگریمان لێ دەکات.
ئەخلی ئافرەتان سووڕی ماگانانەیە پیاوانە.
باشە بۆ لە وڵاتی ئێمە لە کوردستانی ئێمە کاتێککە حملەیەکی خوێن بەخشین دەکرێت زیاتر پیاوان هەست بە بەرپرسیارەتی دەکەن و دەچن بەرەو ڕۆی.
لەبەرەوەی لە وڵاتی ئێمە هەتا ئێستا هۆشیارێکی وان نەدراوەکەوە بگەینە ئەو ئاستە ڕۆشنبیریەکەوە ئافرەتیش بتوانێت خوێن ببەخشێت و بێجگەلەوەش ئافرەتەکان خوێنیان کەمترە تا ڕادەیەکی کەم لە پیاوەکان، یعنی پیاوەکان زیاتر هەست بە مەسئولیت دەکەن. بێجگەلەوەش کەوا ئافرەتەکانمان کەوا سووڕی ماگانەیان هەیە هەتا ئەو حەدەی کەوا پێش ئەوی سووڕی ماگانەیان ڕابوەسێ وا باشترە کە نەیدەن و دوای سووڕی ماگانە دەتوانن بیدەن و باشتریشە.
تا ئێستا خوێن بەخشیوە؟
بەنسبەت خۆمەوە نەخێر.
ئامادە ئەگەڕێژی خوێن گونجاو بوو ببەخشی؟
بەڵێ زۆر ئاساییە.
تەمەن چەندە؟
تەمەنم 23 ساڵە.
زۆر سوپاس. حملەیەکی خوێن بەخشین دەکرێت زیاتر پیاوان بەرەو پیریەوە دەچن. ئایا ئەو هۆشیارە نیە لە ناو تاکەکانی ئافرەتمان یان چۆنە؟
بۆنا هەر هەمومان هەر ئینسانین و ئەوە شتێکە کە لە بۆ جسمی خۆشمان باشە ئەگەر خوێنمان زیاد هەم دیسان زیان بەخشە و دەتوانین و ئینسانێکشە و هەر شتێکە پەیوەندی بە ئینسانێتەبی هیچ عیلاقەیەکی جێندەری نییە هەم ئافرەت هەم پیا و هەردووچان یەکسان دەتوانن بیکەن.
تا ئێستا خوێنت بەخشیوە؟
ناوەڵە.
لە ئایلەکەتان تا ئێستا ئافرەتەکان خوێنیان بەخشیوە؟
بەڵێ داکەم لە بۆ خۆشم کە پێویستم پێ بوو خوێنیان داینێ.
تەمەنت چەندە؟
23 ساڵم.
ئامادەی ئەگەر خوێنت گونجاو بێ خوێن ببەخشی؟
بەڵێ بێگومان.
زۆر سوپاس.
بەتاکید ئافرەتیش یەکێکە لەو کۆمەلگانە ئەیدی پێویستە خوێن ببەخشیت کە جەستەیەن تەواو بێت.
باشە بۆ حملەیەکی خوێن بەخشین دەکرێت جگە لە پیاوان هیچ ئافرەتێک لابینین لەگەڵیان شان بەشان خوێن ببەخشێ.
بەحقیقەت پێویست بوو ئەوانی شان بەشانی پیاوان هاوکار بن لە بەخشینی خوێن. بەخشینی خوێن مانای ئازادکردنی ئینسانێکە جا چ پیاو بێت چ ئافرەت بێت.
تا ئێستا خوێن بەخشیوە؟
بەڵێ زیاتر لە سێ جاری تەمەنیشم 50 ساڵە.
دەست خۆش بێن کولتوری ما وا باوە کە پیاو زیاتر خوێن بدا لە ئافرەت. ئایا لە ڕای تۆ چێ دەربارەی ئەو شتە؟
دەبێت ژنیش باڵپشتی پیاوی بێ وەکو پیاو خوێن بدا.
ئەگەر ڕێژەی خوێنی تۆ ئەو ڕێژە خوێنە بێت کە بتوانی بیدەی ئامادەی خوێن بدەی؟
بەڵێ.
پێت چۆنە لە کولتوری مەش وەکو باڵێن پیاوان چۆن خوێن دەدەن ئاواش ئافرەتان خوێن دەدەن؟
بەڵێ.
باڵپشتی لەگەڵ ئەو شتەی؟
بەڵێ.
ئایا خوێندان بەس دەبێت پیاو بیدایە ئافرەتیش بۆی هەیە بدە؟
خوێندان ئەرکێکی مرۆییە و جیاوازینیە کە ئافرەت بیا یا پیاو بیات ئەبێ هەمومان باەرکی خۆمانی بزانین کە بەشداری بکەین لەو ئەرکە مرۆییە.
تا ئێستا خوێنت داوە؟
وەڵی من خۆم چکە ڕێژەی خوێنم ئەوەندە زۆر بەرز نییە تا بتوانم خوێنمەم، بەڵام ئەگەر ڕێژەی خوێنم بەرز وایە ئەمیە.
یعنی ئامادەی؟
ئامادەم بێگومان.
تەمەنت چەندە؟
21 ساڵ.
21 ساڵ. زۆر سوپاس. ئایا خوێندان ئەرکی بەس پیاوە یا ئافرەتیشە؟
ئەرکی هەر بکیانە، هەم ئافرەت هەم پیاویش.
ئامادەی خوێن بدەی ئەگەر بێت و ڕێژەی خوێنت گونجاو بێت؟
بەڵام ئەم ئێستاکانە خۆم خوێنم زۆر نییە، بەڵام ئەگە زۆر بە ڕۆژێک لە ڕۆژە ئەوە دەتوانم.
تا ئێستا نەداوە؟
نەخێر.
تەمەنت چەندە؟
25 ساڵ.
باشە بۆ ئەگە حملەیەکی خوێن بەخشین دەکرێت زیاتر پیاوان بەڕوویدا دەڕۆن وەک ئەو لە ئەوەی ئافرەتان؟
زیاتر پیاوەکان لەبەرەوەی بەهۆی سوڕی مانگانەوە ئافرەتان زیاتر خوێن دەبینن، مانگانە خوێن دەبینن، بەڵام پیاوەکان ئەو خوێنە زۆریان لێ ناڕاتن بۆیە پیاوە زیاتر خوێن بدەن.
دەست خۆش بێ زۆر سوپاس. خوێندان بەس دەبێت پیاو بدا یا ئافرەتیش؟
ئافرەتیش ئەبێ بیدا و شیار بێ و لەسەریشی پێویستەکە بیدا وەکو ئینسانیەت.
تا ئێستا خوێن داوە؟
نەوەڵام من حەزەکەم خوێن بدەم بەس هەر چەند جارێک هەوڵیشم داوە چوومە لەبەرەوەی کەم بۆ لێمیان وەرنەگرتووە.
ئەگەر بێت و خوێنت هەبێ ینی ئامادەی بیت؟
ئامادەم.
خۆش بێ نمونەت زیاد بێت. تەمەنت چەند بوو؟
36 ساڵ.
36 ساڵ. دەستەکانت خۆش.
سوپاسی دەکەم ڕێز.
ئایا پێت وایە ئافرەت دەتوانێت خوێن بدا؟
بەرێ ئافرەتش پێویستە وەکو شامەشانی پیاوان خوێن ببەخشی، هەم سوودی بۆ خۆشی هەیە هەم بۆ سوودی بۆ کۆمەلگاش هەیە.
تا ئێستا بۆ خۆت خوێنت بەخشیوە؟
هەتا ئێستا بخۆم نەم بەخشیوە بەس یعنی پێویست بخۆم خینم زیاد نەباتا ببەخشم.
ئەگە خوێن زۆر بێت
ئەگەر تەبعاً ئەرێ وڵەکە خوێنم زیاد بی بخۆم ئامادەمەوە خێزانەکەشم ئەگە خوێنی زیادی ئەوش ئامادەیە ببەخشێ، هەم سوود بۆ خۆی دەگەینی هەم بە کۆمەلگاش دەگەینی.
زۆر سوپاس. زۆر سوپاس. باشە بۆ ئەگە حملەیەکی خوێن بەخشین دەکرێت لە وڵاتی ئێمە زیاتر پیاوان بەرەو پیریەوە دەچن، ئایا دەکرێت ئافرەت خوێن بدات؟
بەئەکید بۆنە ئەگەر ڕێژەی خوێنەکەی باش بێ بۆنە بەئەکید ئافرەتش دەتوانێت بیت.
تا ئێستا خوێنت داوە؟
نەخێر نەمداوە بەس
لە عایلەتان خوێنی داوە؟
بەڵێ داکەم خوێنی ئەو ناقسە و 6 بوتڵیشی دەوێت.
زۆر باشە. ئەگەر بێت و خوێنت گونجاو بێت و ڕێژەکەی گونجاو بێ ئامادەی خوێن بدەیت؟
بەئەکید دەیدەم.
تەمەنت چەندە؟
29 ساڵ.
29 ساڵ. دەست خۆش بە خاتم سوپاس. خوێن بەخشین دەکرێت زیاتر پیاوان بەرەو ڕووی دەچن لەوەی کە ئافرەتیش بچێت.
بەڵێ ئاسایی ئافرەتیش خوێن بەخشی شانبەشانی پیاوان.
تا ئێستا خوێن بەخشیوە؟
نەخێر.
لە ماڵەوە لە ئافرەتەکانتان تا ئێستا خوێنیان بەخشیوە؟
نەخێر.
ئامادەی ئەگەر بێت و ڕێژەی خوێنت گونجاو بێ خوێن بەخشی؟
بەڵێ ئاسایە.
تەمەن چەندە؟
30.
زۆر سوپاس خاتم. ئایا پێت وایە دەبێت ئافرەت خوێن ببەخشێ؟
بەڵێ بەڕێی من زۆر ئاساییە ئەگەر لە ڕووی پزیشکی و ڕێگا پێدرا بێتن ئەو ئافرەتەکە خوێن ببەخشێتن زۆر ئاساییە، چونکە لە کۆمەلگەی ئێمەدا زۆر جار دەوترێت ئافرەت نیوەی کۆمەلگایە و دایکی نیوەکەی تریشە، مانای بەردەوامبوونی ژیان لەسەر گۆی زەوی لەسەر ئافرەت وەستاوە. خوێن بەخشینیش مانای بەخشینی ژیان و بەردەوامیە، بۆیە هیچ ڕێگریەک نییە لەوەی ئافرەت بەشداری بکات لەو بەردەوامبوونی ژیان.
لای تۆ ئاسایە خۆت تا ئێستا خوێنت بەخشیوە؟
بەڵێ بەخۆم خوێنم بەخشیە. بەڵێ.
تەمەنت چەندە؟
41 ساڵ.
زۆر سوپاس نمونە زیاد بێ. ئایا پێت وایە دەبێت ئافرەت خوێن بدات؟
بەڵێ چکە خوێندان ئیسفادەی زۆری یەک لەبارە خۆم کە خوێنمدایە هەموو ساڵەکە بتە خوێن دەدەی لەبوو هەموو ئەندامی جسمی پێویستە ئەو خینە پاک دەبێتەوە خۆرگە سوورەکان دروست دەبنەوە هیوادارم هەموو ئافرەتان هەموو خوشکان کە هەموو ساڵێ جارێک بچن بتڵ خوێنێ بدەن هەموو ژیانی کەسێک ڕزگار دەکەن و هەموو ژیانی خۆشیان ڕزگار دەکەن لە هەموو نەخۆشیەکان وا لە خۆرگە سوورەکان کە دروست دەبێتەوە ئافرەت زۆر پێویستە لە کۆمەڵگایمە بچی خوێن بدەن
تا ئێستا چەند بتڵە خوێن
تا
بداوە؟
ئێستا خوا لە خێری دەرنەکە 30 بتڵ خوێنم داوە هیچ زەرریشی لێ نەکردووە لە تەمەنی 20 ساڵی و ئێستا تەمەنم 43 ساڵە
یعنی پێت باشە ژنا ئافرەتانی شانبەشانی پیاوان کاتێک حملەیەک دەکرێت بچن بیدەن
زۆر باشە کە ئافرەتان شانبەشانی پیاوان بچن چکە هەر ئەکە لەسەر پیاوان نێ لەسەر ئافرەتانی شا لەسەر خوشکانی شا بچن ئەو خوێنە بدەن هەم خوێنی لۆ تالاسیمەی هەم نەخۆشەکان ژیانی کەسێک لە مردن ڕزگارکەن ژیانی خۆتان لە مردن ڕزگار دەکەن
زۆر سپاس نمونە زیاتر بەخشێ
بەڵێ دەتوانێت ئەگەر لە ڕێی دەستەوە ئامادە بێت
باشە بۆ ئەگە حملەیەکی خوێن بەخشین دەکرێت جگە لە پیاوان هیچ ئافرەتێک نابێنی شانبەشانیان ڕابوەستن و خوێن ببەخشن
ئەو ڕۆشنبیری یان ئەو کەمترەکە لە پیاوی لەناو کۆمەلگای هێشتا ڕۆشنبیریە تاو بەرپانیە بۆ ئافرەتەکان لەبەر ئەوەی ناچن بۆ حملەی خوێندان لەنا حملەی خوێندان شتێکی زۆر پیرۆزە گیانی کەسێک کە ڕزگار دەکەی لە مردن
تا ئێستا خوێنت بەخشیوە؟
بەڵێ
تەمەنت چەندە؟
30 ساڵم 12 جاریش خوێنم داوە
نمونە زیاد بێ زۆر دەبێ ئافرەت خوێن ببەخشێ
هەرچەندە بەرچاوڕوونیەکی تەواو نییە بەڵام ئەگەر لە ڕووی جەستەی و لە ڕووی تەندروستیەوە بۆ ئەوان باش بێت لە ڕووی کۆمەڵاتیەوە پێم وایە شتێکی زۆر ئاساییە نۆرماڵە
باشە بۆ ئەگەر حملەیەکی خوێن بەخشین دەکرێت یعنی هیچ ئافرەتێک نابینین لەوێ جگە لە پیاوان
لەبەرەوەی واحەیەکی تەواو تێگەیشتنیش تەواو نیە تا ئێستا لەو بوارەدا تەنانەت بۆ خودی پیاویش نەک بۆ ئافرەت
تا ئێستا خوێن بەخشیوە؟
بەڵێ یەکێکم لە ئەندامە کارەکانی کۆمەڵی خوێن بەخشان
زۆر سپاس نمونە زیادە تەمەن چەند بوو؟
39 ساڵ 36 ساڵ عفوا
زۆر سپاس برأيك هل للامرأة يمكن لها أن تتبرع بالدم إلى جانب الرجل في مجتمعنا؟
حسب رأيي بأن المجتمع يتكون من الامرأة والرجال وحسب اعتقادي بأن ليس هناك أي مانع من تبرع الامرأة بالدم إلى جانب الرجل في المجتمع لا يوجد أي سبب طبيا أو أي سبب يمنع الامرأة من تبرع بدم إلى أي شخص آخر لأن هي مثل الرجل لديها خصائصها ولديها الدم التي يوجد في الرجال يوجد في الامرأة يمكن لها أن تتبرع بالدم.
هل تبرعت بالدم؟
تبرعت مرة واحدة بدم إلى شخص آخر.
شكرا.
يا سلام.
Thank you very much for Ms. Shanas for preparing this nice video. Now we will go to our next presenter, Dr. Naushirwan Sadiq Jabari, hematologist, assistant professor in College of Medicine of Howler Medical University. He will present regarding donor selecting criteria and comparing men to women. Please, Dr. Naushirwan, I think I make you as co-host so you can talk and share your slides.
Thank you, Dr. Hamdia, for this opportunity, and good morning, everyone. One of the most common causes of low percentage or low number of women donation, I think it's lack of awareness among women about the blood donation and about the outcomes of blood donation. That's why I think this event is very important, and I wish to see more of like these events to encourage and to spread awareness about the blood donation. Today's my presentation in this event is about donor selection criteria. So in general, a donor must be fit and healthy, but how we assess this? So donor selection determines the eligibility of a donor to donate blood and blood components in a way that we have to ensure that the donor will be safe at the end of donation And at the same time, we have to ensure that there is no any risk of transfusion transmitted infections or other adverse effect to the recipient. As Dr. Hunnar also mentioned, these types of blood donors, we have two types: voluntary donors, persons who donate blood on their own, and also replacement donors from within the patient's own family or community. So the registration for donor selection has four major components. First of all, we have to take a consent for blood donation, and after that, there must be a questionnaire asking many questions to the donors, and the donors should reply to the questionnaires, fill the questionnaires, in order, if we see something not fit or something unhealthy or something unacceptable, we can refer or reject the donor easily. And after the questionnaires, we have to do some physical examinations and also some simple laboratory tests. So donor registration should include donation date and time and the last and first name of the donor if they have a back history, or if they have a back history of rejection. And also we have to address the patients and telephone numbers and gender of the patients. Regarding medical history, we have to ask some questions by a trained healthcare professional person. It must be assured that the confidentiality of the donor should be maintained so that the donor feel satisfied to answer any question. And there must be some direct question or leading questions about the medical history of the patients. The standard medical information questionnaire, which helps to collect same information systematically from each donor. So some questions are present in the questionnaire, but also we have to ask the patient for more reassurance. And this question can give information which make quick assessment whether to accept or temporarily defer these donors or permanently reject the donors. So regarding physical examination, first of all, we have to start from general appearance of donor. Donor should be fit and healthy. That means sometimes just by look we can assess the donor if he is healthy or not. If the patient of the donor is pale, if the donor feeling unwell, and so on. And minimal physical examination include the blood, checking the blood pressure. If the patient is hypertensive, should be deferral, and checking the pulse rate of the patients. And acceptable blood pressure should be within normal range. That means there is diastolic blood pressure between 60 to 100 millimeter mercury, and the systolic between 100 to 160. It may be acceptable if the patient have no history of, or the donor have no history of hypertension. Temperature should be within normal range, and donor weight is very important, because if the donor is less than the acceptable weight, the amount of blood should be less than the usual amount, which is 450 ml. Also, we have mandatory test on all blood units. After taking the blood from the patient, we have to then from a pilot sample taken at the time of donation. The tests include determination of the ABO and RH typing, and tests for HIV by ELISA or other confirmatory methods, and tests for hepatitis B surface antigen, and tests for HCV virus, and tests for syphilis. And at the same time, we have to do screening for atypical antibodies if it's available. And another thing which is important for the donors to know is the donor interval. The minimum time gap between the blood donation should be 3 months. Interval between 2 platelet freezes is around 3 days. Not more than 2 procedures to be done in a week for platelet freezes. Whole blood donation must be taken for at least 1 week after can be donated the platelet freezes. And sometimes, in case of platelet pheresis, there may be re-infusion failure after pheresis procedure. So at that time, donor should not donate whole blood for 3 months. So the interval should be about around 3 months. And every donor should have signed informed consent, and that the donor has understood all the donor information present and have all his questions been answered. Also, the donor should know that his blood would be tested for transfusion transmitted infection. And also, the donor should inform about the screening test if they are reactive or not. And the donor should tell if they want to inform about abnormal test results or not. And finally, they should sign the informed consents. Records for donor, we should register the numbers and tube segment numbers and name of the donors and age and address and the blood group and date of expiry, even the signature of the doctor and signature of phlebotomists and weight of the donor. All this information is very important to be recorded in the donor record registration forms. And after blood donation, what's important to do and what's not to do? After blood donation, the donor should have a plenty amount of water. At the same time, if he is available, he should eat a healthy iron-rich meal which contains meat. And of course, those donors should have an ID and bring their ID with them. Things that should not do, the donor should not drink alcohol and should not eat fatty foods and should not take aspirin if the donor wants to donate platelet. Also, the donor should avoid strenuous exercise, weightlifting for 24 hours, and the donor should not smoke for around 1 hour after donation, and the donor should not drive for at least half an hour. Report to blood bank in case of any adverse reaction occur. He should call the blood bank and inform them about any side effects of donation. And major conditions for donor deferral, we have a lot of situations or conditions that need deferral of the donor to, and we may defer them or reject them permanently. For example, in case of abortion, the donor, in female, the donor should be deferred for at least 6 months. In case of blood transfusion, if the donor received blood, also should be deferred for 6 months. In case of major surgery, all those the donor should be, or major accidents, the donor should be deferred for 6 months. In case of some infections like typhoid, should be deferred for 6 months. In case of malaria, should be deferred for 3 years after a cure. And tattoo, donors with tattoo should not be, it's not acceptable as a donor. And in case of breastfeeding and pregnancy, the donor should be deferred for 6 months. And conditions that the donor will be rejected for example, if the donor has cancer disease or heart problems or abnormal bleeding tendency or unexplained weight loss, or patients with diabetes mellitus controlled by insulin or controlled by oral hypoglycemic agents, and case of hepatitis B or hepatitis C, and even if there is suspicion of HIV infections and chronic renal disease, chronic liver disease, all these situations not acceptable as a donor and should be rejected permanently. The main points in the questionnaire, I want to highlight some of them. Is age. Acceptable age is between 18 to 65 years. Sex, in case of for female pregnant and lactating ladies, are rejected, accepted after 6 months. and some hazardous occupation, there should be a window between donation and returning back to the works around 12 hours. Any major illness like epilepsy should be deferred unless off treatment for 3 years. And if there is serious active chronic or relapsing gastrointestinal or genitourinary or hematological or immunological metabolic or renal respiratory disease, the patient or the donor should be permanently deferred. In case of severe hypertension, also severe allergy and thyrotoxicosis and autoimmune disease, all these situations should be rejected as a donor. In case of drug abusers, IV or IM, in case of aberrant sexual behavior, those donors permanently defer. And sometimes there are some questions about these situations in the questionnaire. So the donor, when they read the questionnaire, they will be rejected, or when they answer the questionnaire, they will be rejected without test and without physical examination. And if the donor have abnormal bleeding tendency, there will be permanently deferred. In case of infections, for example, in case of syphilis, bar 1 year following complete cure. In case of malaria, if the donor have visited endemic area of malaria, should be deferred for 6 months. But if the patient have diagnosed with malaria, should be deferred for 3 years of being asymptomatic and of therapy. Cases of TB and tuberculosis should be deferred for more than 2 years after complete recovery. Intercurrent infection, deferral at least 2 weeks following full recovery. In case of toxoplasmosis, the donor should be deferred for 6 months following clinical recovery, and in case of Kala-Azar, there will be permanent deferral. Rheumatic fever, it should be deferred for 2 years following cessation of the symptoms. And if the fever is more than 38 centigrade or flu-like illness, 2 weeks after cessation of symptoms, they can donate. In case of minor surgery, the deferral will be for 1 week, and in case of dental treatment, may need only 1 day. And there should be special guidelines in cases of outbreaks of certain diseases, like what we have now in Corona outbreak. So there should be a special caution or precaution for the donors to donate in this situation. So the donor should be sure that he has not infected with coronavirus or COVID-19 when he wants to donate. In case of vaccinations, live vaccines defer for 4 weeks, while killed vaccine and toxoid and immunoglobulin, there may be no need for deferral. And any donors on this list of drugs should be rejected or should be deferred until stop the drugs. These drugs including anticoagulants and insulin and antibiotics, steroid, IV narcotics and alcohol, even anti-epileptic drugs. Other miscellaneous questions related to questionnaires. Some donors have polycythemia vera, which is clonal disease, and the patient have increased level of hemoglobin. And one of the part of the treatment is venous sanction and donation of blood, but these blood should not be used in the blood banks. And in case of minor red cell abnormalities, for example, like sickle cell trait, if the patient's well and hemoglobin level is normal, within normal, patients, donors can donate. And in case of thalassemia trait, acceptable if good health and fit and satisfy hemoglobin. And recent unexplained weight loss should be rejected until we reach the diagnosis.
Sorry, Dr. Nashran, only 2 minutes remain, sorry.
Yes, okay. Something is important to mention here during donation. There may be some untoward effects during the post-venous sanction, and these most common complication or side effects, which is rare, include syncope and nausea and vomiting and twitching and muscular spasm and sometimes hematoma due to venous function and arterial puncture and convulsion, which is very rare, and cardiac or respiratory insufficiency of those donors who have cardiac problems. And finally, we have to know that 1 pint can save 3 lives, and at the same time, everyone may become a saver, including women. Thank you.
Thank you very much, Dr. Naushirman, for this nice presentation. And also I appreciate his suggestion regarding to making this symposium on today, June 14th. Our next presenter is Dr. Aryan Rizgar Ganju. She is assistant professor, medical microbiologist in Howler Medical University. And she will present for us the benefits of blood donation for women. Please, Dr. Aryan, I think I make you, if you, okay. فرمو دکتر آریان. دنگت نه دکتر آریان. خود unmute که به زحمت.
Okay, thank you, Dr. Hamdia, for giving me opportunity for speech. And today my presentation will be under the title of Benefits of Blood Donation for Women. And I'm happy that today is the June 14th, which is the world's Blood Donor Day. And we have such activity in this special day. So let's start talking about the importance of blood donation. The reasons, or there are many different reasons that make people need blood transfusions. I'm sure that my colleagues, they are covering some of the information about the blood transfusion and blood donation, but here we have the main points like accidents or victims. They are getting injury or external or internal injury or burns. They are more prone to needing blood transfusion. And also sickle cell anemia or hemophilia and other abnormalities that happened or inherited abnormalities of the blood, they require blood transfusion. Also, patients, they are suffering from cancer and premature birth, females that they are during delivery, maybe they need or they are facing complication during delivery or cesarean sections. Those are also, they require blood. And also surgery, especially complication during surgery like cardiovascular, orthopedic surgery and other complicated surgery, all are there. They need or they are in urgent need for blood transfusion. So here we can see the summarizing of the peoples who need blood or who needs urgent blood transfusion. Like as I mentioned, the general surgery and females who are during the delivery and cesarean sections, bleeding disorders, accidents, and patients who are suffering from cancer, especially leukemia. It's important to know that a human cannot be manufactured, so that's why people are the only, or human are the only source for it. That's why it's important to donate blood and helping those people who need the blood around. So as other colleagues said, there are every 3 seconds in the world, someone needs a blood. But unfortunately, the bloods that donated and preserved in the banks, blood banks, it's not lasts for more than 40 days. Then it must be disposed of. That means we need to constantly replenish the blood so that it's there when someone needs it, it will be provided for them directly. But we can motivating the peoples or peoples around us, or motivating peoples in the social media or in everywhere, that not everyone can save a life, but you have an opportunity to. So don't waste it. So we have motivating every individuals around us to saving the other's life and donating the blood. Here we have some myths with the facts about the blood donation. I'm focusing on the female. Most females, they are thinking that the blood donation may be, it hurts, or most of them, they said, we don't have enough time to blood donation. And some of them, they think that blood donation leads to the weakness, and females mostly cannot donate the blood. But all these are the myths. The facts not like that. Peoples who are, or healthy persons who are weighing more than 45 kg and in a good health, with the age or adult, the age between 18 to 65, can donate the blood regardless to their gender. The gender is not obstruct the donation of the blood. And also the fact that the myths that mostly when you donate the blood, you get the weakness. It's not a bad, it's not a right idea. Blood donation never leads to the weakness. It's moreover bring a new energy and making a new red blood, new blood cells to the human. Let's concentrate to talking about the benefits of the blood donation. We can defining or concluding the blood benefits of blood donation in 3 main points. One of them, money, health, and saving someone, saving lives of someone else. So first, I want to talking about the money, because this money is also important for most of the individuals here. So every donor persons, they get a checkup list for free. So there is a number of tests that will be done for the donor without a price or free. This is the main point. Regarding to the health, we have lots of benefits to the physical health. I will mention it later. And the last one, which is the main important humanitarian acts, which is the saving the life. Let's starting with the first one, which is money. As I said, the blood donation not only makes the receiver's life good, but also helps the donor to maintain a good health. So the first one, I will cover the free health checkup. The persons who are planning to donate the blood undergo different screening health that include a list of tests important before donating the blood to be performed for checking out, like the blood pressure, pulse, and body weight, body temperature, hemoglobin level, also the list of the tests that require for finding out the infectious agents, like special viral infections like hepatitis B and C, also HIV, human immunodeficiency virus or AIDS test. Those will be done for free without charge for the person who are planning or are coming to donate the blood. So also beside the checkup tests, during the checkup, the donor have to answer the questions or questionnaires that my colleague, Dr. Navshivan, he covers some of the points. He said that we have a questionnaires to be filled out. During the checkup, the donor have to answer questions relating to the medical history and also undergoing health screening. This form of free medical test is definitely will be helpful to the persons who are planning to donate the blood. Also, or we can say can take advantage of all the tests that done for free for this person. This is the first number one. We said that it's free checkup test will be done for the person who are planning to donating the blood. Let's talking about the benefits that relating to the health of or donor health. One of them, or one of the important points, is reducing the risk of heart and liver disease. So reducing iron in the blood has a very advantage form, because reducing the risk of reducing the heart attack and strokes. Also, some researchers, they are finding out it's related to reducing, or we can say reducing the iron level in the blood have effects on preventing some other disease like Alzheimer's and even Parkinson's, because excess iron in the body can constrict the blood vessels in the heart and liver where it's stored. As a result, maybe more prone to getting the disease to these organs that I mentioned. Another point, lowering the chance of cancer. So iron reduction also associates with the lower chance of cancer and mortality. In iron accumulation, heightens the risk of getting chronic disease and cancer, especially colorectal cancer. Among women who are or preserving or protecting females from the cancers even. Why? Because the women's cancer risk increases after the menopause, since the body have no longer losing the excess iron in the body, or the iron will be accumulated, so making them more prone to getting cancer. That's why we can say who regularly donating blood had a reduced risk for developing subsequent cancer than those who didn't. Another points or benefits for the blood donation in making new blood cells. As previously mentioned, only about 1 pint of the blood supply used during the blood donation, and the others, or approximately 10 pints of the blood or the average blood will remain in the body, and the body can replace those pints of 1 pint of the blood as quickly as possible. So yet what's even more amazing is that the fact that the body has a way of replacing the blood has lost, and in fact the body only needs a few days to make a new blood cells, or a few days required for making new oxygenated rich blood cells to the body. Another important or interesting things that we had, mostly, or females also, we have to more encourage them to blood donation, because it's related to the body weight loss. So every time the donor persons during the blood donation maybe burn about or more than 600 calories, which is a good news for the female, because mostly they are suffering from the obese, or they are suffering from why I'm overweighted. So in this case, we can motivating them during the donation of the blood. You can burn around or more than 600 calories from your body fat. This is because the body must replenish the blood cells. Also, it affects to the cholesterol level in the body. When we are donating the blood, you are also getting rid of excess amounts of the fats and lipids in the body, or in the body. This is important so that the fat deposits not accumulate in arteries, and also lowering the cholesterol level and reducing the risk of heart disease, which is one of the main or benefits of the blood donation. And let's talking about the mental health, and it's important, or the persons who are donating the blood get improved of mental well-being. The health benefits of donating blood don't just relate to the physical aspects, but also psychologically speaking, choosing to be a blood donor can uplift human spirit too. Why or how? It can be helpful by reducing the stress and benefits on the health or physical health. Emotionally, it's important. Also help get rid of negative feeling, providing a sense of belonging and reduce the isolation. Those are important for as I mentioned, beside the physical health, these are the benefits of the mental well-being. The last thing, which is one of the main important points for blood donation or for donors, it's a humanitarian act. Donating blood can be the highest form of humanitarian. Without blood donation, as we said, patients can't undergo any surgery or can't continue their routine lives or even recovering from the illness. So that's why we can say in the bracket that we may not be able to help cure someone from life-threatening or from life-threatening disease, but we can definitely help someone stay alive when we donate the blood. That's why I can conclude or I can summarize the reasons to donate the blood. We said, or I mentioned a lot of points, but I can mention the main points that it will reduce the heart attack, it reduces the chance of cancer, and will be helpful to weight loss, also replenish the blood cells and making new blood cells, and also saving someone else's life, which is the main, those are the main reasons that making the any individuals to thinking or planning to donating the blood. The different criteria that's required for the female, Dr. Nashwan, he mentioned lots of points, but for females, because mostly females here, they are thinking when we are donating blood, maybe we don't have enough time to donate blood, or we are so busy with the life, or we are maybe during the blood donation, it hurts us. So those are all are obstacles for donating the blood by the female. But all are not the facts. Only the facts when females cannot donate the blood are those points. Just during pregnancy, delivery, or within the 1 year of delivery, when lactating, and during the menstruation cycles or 7 days ahead. Those are obstacles for not donating the blood. Also, in some countries, they talked about the females or any individuals who are consuming alcohol previous 24 hours also should not donate the blood. Otherwise, the females can, or healthy females can donate the blood without any hesitation. Also, we talked about the obstacles or the females should not donating the blood. We have some health conditions, as other colleagues mentioned, patients who are suffering from hepatitis and other viral infections, and people who are vaccinated or undergoing surgery or having cancer, diabetes, or other disease should consult health experts before donating blood. Otherwise, they can regularly or deciding or planning, they can planning to donate the blood. I will conclude the presentation that the blood donation is very important for saving the other's life. Beside the health factors that we mentioned, the blood donation would be helps the iron or balance, important for balancing the iron level in the blood, it's important for maintaining the body or better blood flow, important for burning the calories during the blood donation, also important for production of new red blood cells or new blood cells. Besides that, reducing the chance of cancers and also making the cardiac or heart more healthier. Those are the main important points that makes us to decide or even planning to donating the blood in the future. Thank you, Doctor, for giving me opportunity again for making a brief benefits, or I can just talking about the brief about the benefits of the blood donation. I hope that will be a starting points for motivating, first of all, ourselves, then the pupils around us to starting or planning the donating in the future. Thank you again.
Thank you very much, Dr. Aryan. Your presentation encouraged me to give at least 1 pint yearly, and I go to Dr. Hunar next week to give 1 pint blood. And it was very useful. Thank you very much, Dr. Aryan. And because you were female, I give you more 2 minutes than our male presenters.
Okay.
Thank you very much, Dr. Aryan. It's very nice.
Yeah.
Now,
so I will be happy for planning or encouraging Dr. Hani, encouraging the students, because students, they are in optimal age for donating the blood. So making accompanying or camping, encouraging the students, especially the females, first of all, to starting or planning for donating the blood. So because, as I said, in females around the world, and even in Kurdistan, they are afraid from blood donation, because mostly they said, first of all, I don't have enough time, or it may be hers, or I'm so busy, I have children, I don't have time to donate blood. But we can motivating them, starting from the students inside the college, later to going outside, or at least the crew group, we can making a group for advising peoples around us to donating or starting to donate the blood.
Hopefully, we are happy that we start today as our center, and hopefully we'll help of you and other people. We will encourage this, the culture of women blood donation. Thank you very much, Doctor.
Thank you
Our
again.
next speaker is Dr. Tavga Hoshyardizai. She is a pathologist in Howler Medical University, and she will present for us about the eligible women for blood donation. If you stop your share, Dr.
I did.
Dr. Aryan, please unmute yourself.
Now the slideshare is stopped.
Yes. Dr. Tavga, خود unmute کرد. Then good night.
Now it's good?
Yes.
Okay, thank you. Good morning. First of all, I want to thank Dr. Hamdia for this opportunity to make me a part of this interesting subject. My part, as Dr. Hamdia said, is who are eligible to donate blood. First of all, in general, any healthy adult, male and female, can donate blood. However, because of difference in the bodybuilding and because of the menstrual cycle, men can donate safely once in every 3 months, while women can donate every 4 months. The requirement or the criteria, the age should be not less than 18 years and not more than 65 years. The weight should not be less than 45 kg. Body temperature, blood pressure, pulse rate, as Dr. Nashirwan said, should be all within normal limits. And the hemoglobin, regarding for the female, should not be less than 12.5 grams per deciliter. Contraindication, we have 2 types of contraindication, absolute and temporary. The absolute contraindication subdivided to hemotransmittive disease. For example, patient infected with the HIV or any other sexually transmitted disease like syphilis, leprosy, or hepatitis B, C, viral, even patient with the Mycobacterium tuberculosis, TB, brucellosis, typhoid. Parasitic infection such as leishmaniasis and toxoplasmosis. History of multiple sexual partner, or even history of genital ulcer, because also increasing risk of sexually transmission of sexually transmitted disease. Somatic disease, also considered to be as absolute contraindication, like a cancer, any type of cancer, breast cancer, prostate adenocarcinoma, any type. Cardiovascular disease, such as patient with the congestive heart failure, chronic respiratory disorder, like asthmatic patient, peptic ulcer, including both duodenal ulcer or gastric ulcer, epilepsy, or even mentally retarded patient. Disease of the blood, such as thalassemia, sickle cell anemia, anemia of chronic disorder, diabetic patient, especially those on insulin injection, while those patients taking oral treatment have no any contraindication. Drug addiction of different type, heroin and any type. Temporary contraindication, for example, alcoholic patient. She have to wait at least 48 hours for donation. Tattooing or acupuncture, she have to wait at least 6 months after tattooing. Contact with the patient having hepatitis A, B, C. Staying in endemic country for malaria. And tooth extraction, which considered to be, it's a minor, for example, she have to wait 3 days. Regarding vaccination, it depends on the type of the vaccine. So for the killed vaccine, like for hepatitis B, she can wait only for 10 days, while for live vaccine, she have to, like BCG, she have to wait for 1 month. Operative intervention, this is very important, including abortion, because it's totally depend on the gestational age. For example, if the abortion happened within the 1st and 2nd trimester, she have to wait 6 months. And if the abortion or stillbirth happen after at the 3rd trimester, she have to wait at least 9 months. As a continuation of temporary contraindication, period of menstruation, she have to wait 5 days more from the end of menstruation, especially if she doesn't have any more contraindication like heavy menstrual bleeding, menorrhagia, or any complication of menstrual cycle. Pregnancy and lactation. During pregnancy, as you know, the lady need more blood, more iron, vitamins, mineral to support herself and fetus. However, the volume of the blood increasing more than 50%. For this reason, donating blood during the pregnancy, it increases risk of complications such as anemia of the mother and fetal distress. So for pregnant lady, she have to wait 1 year after pregnancy and at least 3 months after lactation. We have to know why all the blood service usually ask lady about the past pregnancy and about the number of the pregnancy she had. The aim of this question is to identify donor at risk of carrying antibody in the blood that may, when transfused to a recipient, cause a rare, complicated medical condition which is known as transfusion-related acute lung injury. This complication has no effect on the donor, but it is very complicated situation for the recipient, especially for those which are critically ill or ICU patient. So this condition is defined as new acute lung injury that occur during or within 6 hours of transfusion. So it is an acute condition, and it should not be explained by another acute lung injury risk factor. This condition can happen by transfusion of 1 unit of whole blood or any part of the blood product. And the mechanism is that with each pregnancy, the female bodies forming an antibody against human leukocyte antigen or anti-neutrophil antibody, which and the risk of accumulation of this antibody within the blood are increasing with each increased number of the pregnancy. If after transfusion, this antibody can be transfused to the recipient, and is usually leading to acute lung injury, which, as I said, is happening within the first 6 hours, and it is due to bilateral infiltration of this antibody in the lung, causing damaging of the endothelial cell and alveoli, leading to hypoxia. The patient presented with the hypoxia, and it is not hydrostatic edema. So what I mean, we have to differentiate this condition from the other complication of the blood transfusion, which is called TAGO, which is due to blood volume overload. Is very common in patients with the heart failure. This injury or this complication is most commonly associated with the platelet and plasma, more than packed red blood cell, and is also more common in those patients with pre-existing inflammatory disorder or states such as sepsis, and it is very common in, as I said, in critically ill patients, and mortality rate is high, up to 50%, especially in ICU patients. Okay, thank you.
Thank you very much, Dr. Tavga.
Thank you, Dr.
Although the first, it is some overlap with Dr. Nevshirman, but the repetition also, it was okay. After that, we talk more about the women. Thank you very much. It was very interesting.
I want to say something orally. We have to reassure the woman, as Dr. Aryan, she said, about, and to explain for her the benefit of the blood donation. This is very, very important in order. The reassurance and psychological support is very important, because everybody, they say, oh, I cannot donate blood, it is very dangerous. But we have to explain for them, and I think it will be benefit for the community. Thank you.
Thank you very much, Dr. Tavga. Our next speaker is Dr. Ronak Tahir Ali. She's medical physicist, assistant professor in College of Medicine of Howler Medical University. She will present for us about the review literature of women blood donation. We want to know what research say about that. Please, Dr. Ronak.
Bismillah ar-Rahman ar-Rahim. Ladies and gentlemen, first of all, I will thank Professor Dr. Hamdiya. It's an honor to me to participate as a presenter to discussing review literature of women blood donations. As an introduction, I want to just a small note about the blood is a major vital component of the human body, since it can't be manufactured, artificial, and can only be obtained from human resource. So they didn't have any factory that we give us the blood, just the human. Blood donation has become an important, essential process that every healthcare facility should take into considerations. There has been growing interest in gender differences in medicines. In the last decade, as a progresses, fell short importance differences between the sex with regard to etiopathogenesis, clinical response to treat in virus disorder. What's our objective in my presentations? The first things, designing effective recruitment strategy that could encourage women to donate blood to cover the patient need. The next one, assess the knowledge, attitude, and beliefs of female attendants accompanying the patient. The last one, determine the factors which encourage blood donation in women. Of course, because my presentation is about the literature review, so just I want to show you a little literature. In 1999, showed gender differences in the time between donation, which appeared between the first and second donation in women, whereas the third donation onward between one donation and another was shorter among men than among women. Another study in 2002 investigated socio-demographic, medical, and attitudinal factors related to, in a sample of 385 subjects, contact telephonically. This study is done in United South America. Another study, 2006, play an important role in adverse reaction. So sometimes, as the other friends, colleagues that mentioned, we have to be causes of blood donation adverse reaction and whether blood donor return again in the doctors. So sometimes we have to be happen this reaction. Another study in 2008 found a relationship between the intention to make a repeat donation perceived satisfaction with the previous donation. And this study, we have to take 884 subjects. Women had a significantly higher perceived satisfaction than men. And this is good, we can say, data for us. In 2013, another study, more than 50% of population in sub-Saharan country in Africa, included that we have to be discussing to acceptable age that we have to donate from the blood, especially for women, between 15 to 64 years. And another we can say idea in Tanzania that discovered 18 to 65. So it's nearest to each other that the suitable age to donate blood for women. Another study, dear my colleagues, 2014, gender differences in giving blood. An overview of European blood shows that the distribution of men and women donors is similar. This is the only one references that we have to begin that say to us is to be similar, because really more than 100 to 150 research I have researched. All of them that say that the percentage of female is less than the male. Also, the Dr. Hunter, thankfully for him, that we have to show us a table that the percentage of donate female is less than male. So we should, as an organization, Center of Women Health, we should motivate and encourage the women to donate the blood. It's very important for saving our life. Women account for only 30% of donor. This study we have to show us gender differences in blood donation does not seem to have much attention in the literature. Another study, my colleagues, the participation of women in blood donation also in each year, 3.5 million blood donated are collected in Pakistan, and very little percentage of females. This study is done in 2017. Just I want to show you for each literature, or to show you the percentage of the female and what's really the aim of the study you have to be done to serve the blood donation from women. University students also, we should have motivated and encouraged constitute an important coherent for the supplement of voluntary blood donation, considering their age and dynamism. And this study will have to be done in Turkish university students, and positive and negative opinion towards blood donation. In addition, that interpreting their motivators and barriers to this issue. For this reason, a qualitative study we conducted with a total of 141 students studying in one of the governmental universities in the west part of Turkey 2018. And really, from the study, I want to show you just one notice. Really, for our university, or we can say in general in Kurdistan region government, we should motivate and encourage the students to be a donate, especially for we can say students of female, that we have to donate it. And this is how we have to be done, by encouraging, by motivating to donate the blood. Now, a study on 2020 in Iran, reasons of underrepresentation of Iranian women in blood donations. Although altruistic reasons are the chief motivating factors for women to donate blood, but also the percentage of women is remains low. Confidence in the blood donation organization must be a major consideration. It means that like I say in a few minutes, that the big organization, we need to be motivated the women by presentations, by seminar, by workshop, to be a major consideration in future strategy to reassure women about the safety of blood donation. Because as Dr. Adyan mentioned and other colleagues, that sometimes the woman, you have to be afraid, maybe you have a side effect after you have to be donate the blood. In Africa 2020, this study examines the knowledge, attitude, and practice. Really, we need in Kurdistan region government like this study, because really, I don't find any research in our Kurdistan region government that we have to be a research we have to be done in blood donation in women's. Also, we have another research in 2020, sex and gender-related factor in blood product transfusion, that in the results show us understanding the role of gender will help maximize this vital resource and allow donor to women and men, and initially present to donate at approximately similar rate, to be the similar at least we can say, not to be, we have to be hard, as similar to be the same. With some studies showing women present at higher rate. It's very important for us. And this slide, thankfully, I get it for Dr. Huner, that will show us that we have to be the percentage of donate female, we have to be less than the male. And really, we need money, we can say working money, we can say motivated our women, why we have to be this less percentage. And this is our job as academic staff. And I want to conclusion my, we can say, presentation to improve why the woman we have to be not give a donate blood, and also to solve these problems. The first one, there is a need to develop effective intervention for the education and motivation. This is very important. And this is our job as a, we can say, woman center of women health with Dr. Hamdiya, inshallah. The level of blood donation participated in the study area is low. Maybe we have to be low knowledge, that they didn't have any information about the benefit of the donate blood. Poor attitude, awareness creation, and improving attitude. Another conclusion, females are not only reception to this life-saving blood product, but also represent an important donor pool. Some important sex-specific research has already been applied to make transfusion extraordinarily safer. So another conclusion, university students, this is very important, because a younger student, and also we have to be, our students, we need to be motivated, should be accepted as the most efficient group in terms of voluntary and blood donation by the institution. Related to blood donation and awareness study should be planned according to this view. Another point, a higher incidence of adverse reaction among women, we should to be avoided these, we have to be aware adverse reaction. This is our clinician, my colleagues, we have to be adverse. Another point, there are essentially, the last one, there are essentially two factors associated with a greater loss of female donor. Why? The first one is the higher rate of different women often present to give blood, but are not allowed to make donation, most frequently because of a low level of hemoglobin. Another one, the second one, is the high rate of adverse reaction in women, which is related to the low weight of women compared to that of men, which increase the probability of adverse reactions such as dyspnea, or we can say pain, and other colleagues who have mentioned many side effects of blood donate. And also in my literature, I will use many references, but just more than, as I mentioned, more than 100 to 150 years, but all of them I cannot really show you. Just all references we have to be related to the women's blood donations. At the end of my lecture, I will just one small note for my colleagues. Really, we need a group to do research. I'm ready with my colleagues of Center of Human Health. Really, the woman we need to motivate and we can say motivate them to donate a blood. Thank you very much. I hope that we have to be a benefit presentation for us. Thank you.
Thank you very much for your nice presentation, Dr. Ronak, and such interesting for encouraging us as academists for doing the research and also give importance to the blood donation for women. Now we will go to our last presenter today. Again, Dr. Nashwan Sadiq Jabari. He is a hematologist of College of Medicine of Howler Medical University. He will present for us about the research gap in women's blood donation. Which topic and idea we can work on it and doing the research. Please unmute yourself, Dr. Nashwan.
Yes. Thank you again, Dr. Hamdi. Actually, there are a large gap for research in this field, especially in women blood donation. I will try to explain the causes of this gap. Mainly is because, as Dr. Huner in his presentation showed us, a low number of women donors in our locality, and I am looking for the causes of these low numbers of donation in the research to show it, and at that time we have to think about the researches of all these factors one by one to do or to act in the futures. Fortunately, I found that studies said that women seems more willing to give blood than men. And this is a good point in our aims. And also they found that this is a key factor in maintaining adequate blood supply, according to a study done in Michigan in the United States. They observed that women were 31% more likely to offer to donate blood, but the percent of male donors are much higher. Why? Because of the higher rate of temporary deferrals in women, and we all know the causes we mentioned in the earlier presentations, 21% as opposite to 6% deferral in men. And this mainly due to low hemoglobin levels and the fact that deferral itself, albeit for a short time, diminishes the likelihood of donor to return back. Another study showed decreased female numbers of regular blood donors. And the reasons were because they showed that there is a lack of awareness. And this is the main point in our society and in our locality. We have to work, I think, mainly we have to start our work, our research to assess the awareness among the community, among the educated people, among the university students, and so on. So they showed that there is lack of awareness on blood donation among females. No one has ever asked them in a study, no one have ever asked them to donate blood. Lack of information of blood donation and its importance, and don't know where to donate blood. And their doubts regarding blood donation should be clarified, and they should be motivated to donate blood on a regular basis. In 2009, Mesigi et al. Published the results of a study of Norwegian donors, noting that women represented 56% and men 44% of new donors, while the opposite was true among regular donors. They found that percentage of donors who gave blood at least once a year was similar in both genders, and only 30% of new women donors had become regular donors, while 41% of men become regular donors. Temporary deferrals of new donors were also higher in younger women than in men of a similar age. And that's why the women as a regular donors have a low percentage because of temporary deferrals either because of pregnancy or because of menstrual cycle or because of lactations. Another factor contributing to the decline in offers from women is that they suffer adverse effects of blood withdrawal more than men. They found that 9% of women reported vasovagal reaction, 11% reported fatigue, and 12% reported arm discomfort, and as compared to 4.5%, 4%, and 6.9% respectively in men. A recent review showed that women donate blood in Italy compared to between 43 and 55% in other countries. So the authors analyzed various female aspects of donation and note that the reason given for not donating include fear of certain components of the collection process, such as needles, the sight of blood, possible errors, and the feeling of discomfort would seem to be more prevalent in women, and other difficulties that keep female away from donation include women citing medical reasons and vein issues as a significant barriers. Women more than men also tend to mention the negative effects of blood donation on their physical and emotional well-being, with women more frequently than men complaining of the vasovagal type reaction that may occur during or immediate after donation. And the causes of deferral, the most common medical causes for deferral, excluding low hemoglobin, were mild infection and feeling unwell and skin piercing that may disturb the appearance of females sometimes, and maybe drug treatment and hypertension at the site of donation. A deficiency anemia, hypotension, and malaise were almost 3 times more common in women. This is another cause to keeping women away from donation. In addition to factors unique to the woman gender, such as pregnancy and childbirth. Among men, the most frequent reasons for deferral were recent surgery, risky sexual behavior, drug taking, or alcohol consumption, and high blood pressure at the time of examination. And as found in many studies, deferral due to hemoglobin levels below the established limits are much more common in women in compared to men. The problem of venous access in blood donation may be other causes of deferral. And there is also the problem of adverse reactions, especially of the vasovagal type to blood donations. So here, I think we have an opportunity to find in a research to find why vasovagal type reactions are more common in women donation when compared to men donation. So the higher rate, they found that the higher rate of adverse effect of blood donation in female donors appeared to be related to factors that are more common in women, such as lower weight and such as blood pressure, lower blood pressures. There is difficulty that women have in remaining regular donors. In conclusion, the studies showed that women are more willing than men to donate blood as an act of altruism, as evidenced by the fact that there were more women than men among the group of donors. A greater number of women made their first donation, more than the men. The donations offered by women between 18 and 30 years old exceeded those of men. And secondly, it's important to incorporate more women in the group of regular donors by reducing the obstacles, the causes that keep them away from the donation and prevent them from donating blood. This can be done by preventing iron deficiency induced by whole blood donations in women, and by reducing the adverse reactions to donation by introducing measures to offset of these reactions. Also, to take all necessary steps for spreading awareness about the advantages of blood donation, not only for the recipient, but also for the donor himself, could be a motivating factor. For example, we can say that, and documented by studies, that frequent and long-term blood donation is associated with a lower risk of cardiovascular events in donor. And thank you for your listening.
Really, it was very interesting presentation, Dr. Naushirma. Thank you very much. Thank you for all interesting presentations of our speakers today. We remain, our symposium have two parts remain. One part is a 15-minute discussion with the people. I will break out in the you in the rooms, so you can discuss with each other, and then one of you be representative of the group, and you discuss about the recommendation for encourage blood donation among Kurdish women. So if you discuss with each other, after 15 minutes, I will bring back you all together, and each group talk about the discussion or the way or recommendation for encouraging our Kurdish women for blood donation. So now I will break out you into rooms. So I will make you, we are 82, so maybe 6 group is enough, maybe. Okay, now people has to be in room. روما كانت 11 ثانية.
You are welcome.
Okay. Now we start the representation of the groups. Please, in 2 minutes, each room, the representative talk about their strategy or recommendation that they discussed for encouraging our Kurdish women for blood donation. Room 1, please.
Room 1 is, room 1? I don't know. I am room 1, Dr.
I don't know you. When
I don't know. Me too. I'm sorry to say that.
So anyone that you discuss with each other, and
can I start? Yes. Can I start, Dr.
Yes. Yes, Victor.
Thankfully, with my groups, the first one, Nas Khan, Sarparishti Anjumani Afratan, she talked and she has 2 suggestions. The first one, she said the video is very nice, it's very beautiful, but we need to be another video that we have to take with other personality that all of them have donated the blood and more of them to be female. Really, this suggestion is very important to us. And also, she wanted to doing workshop or training about the benefit of blood donate for, we can say, like an organization, or we can say TV, or any advertisement that we have to be encourage the women to blood donate. Another participant, Dr. Sarwa Najjar, she asked a very important question and helpful. We thank Dr. Huner, he answered them. The personality that we have to be have COVID-19, can we have to be blood donate or not, and what are the amount of duration that we need to have to be blood donate without any, we can say, affected? And the answer that we have to be after, we can say, 2 weeks really, and without completely healthy, we can say, without any symptoms. And another question also, Dr. Sarwa, she asked, what about after vaccine? Can we have to be blood donate? Of course, yes, after 14 days. It means that 2 weeks. Dr. Hunar have many suggestions and many opinion also that he said that for 2 years ago we cannot do any, we can say any motivation to blood donate in, we can say inside and outside, we can say Kurdistan region government because of virus. But today for a day of, we can say blood donation, we have to be started again to blood donate. He mentioned a percentage is very helpful, that each day we have to be 60 liters of blood we have to donate from in a day. This is very a bank we can say good things for us. And Dr. Asar, she suggests another suggestion. She suggests that in our college, in our university, we have to be doing workshop and motivate and encourage students about as a voluntary to blood donate. Thank you very much. I hope that we have not to be take more time. Thank you very much also for my groups.
Thank you, Dr. Ronak, and your group members. Now, any other one who want to speak, please raise your hand and you can speak, please.
Dr. Hamdi, can I please?
Yes, Dr. Nashwan.
Yeah.
Now, Shirman, sorry.
Yeah, no, Shirman. Yeah, in our group, there was 2 questions raised about the duration of stored blood. Nowadays, a pint of blood can be stored for 35 days with the preservative inside the bag. And another question asked by Lydia Shemis, I think, asked about the donation of blood from an older man to a young recipient. Is this allowed or not? Yes, it's allowed. There's no problem with that, because the donation of a blood to a recipient is the aim to keep the RBC and hemoglobin level at a normal range to do its function, which is carrying oxygen. So there's no problem between the bloods or RBCs of an adult to a child, or an old man to a young man. As a group, we think that the area of research in this field, women blood donation, should be started about awareness, because the data is disappointing, as showed by respectful my colleague Dr. Hunar. There is low numbers of women that donate blood each year. So if you have a low number of women, how can we do a solid-based study about this subject? So first of all, we have to raise awareness, or we have to study the awareness of the population, especially among young females in the college, and even in adult women, in the mothers that visit the centers. We have to ask them how much they know about the blood donation, and how much they know about the benefit of blood donation, or how much they know about eligibility of a woman to donate blood. That point was raised by my group, and they all, I think, agree with the point. Thank you.
Thank you very much, Dr. Naushirwan, and thank you for the group members too. Dr. Hunar, I think you want to say something.
Yes, Doctora, thank you. Thank you, Dr. Naushirwan, but I want just to give some detail about the blood storage. Blood storage now, since we are separating the products, the components, which are the red cells, the platelet, concentrate, and then plasma, each component has a different storage temperature and shelf life. So now red cells, because we are using a little solution, it will extend the shelf life to 42 days. So now we are storing red cells up to 42 days in fridges, temperature of 1 to 6. And platelets, they are stored at room temperature with agitation for only 5 days, the shorter shelf life among the components. So usually we will face problems with the stock of platelets because of the short shelf life. While plasma and cryo, they will be stored in deep freezers, -23 or colder, for up to 1 year. So these are some details about the blood storage duration or shelf life. And about the age, if somebody may ask about age limits, and some of the presentation was mentioned about age limit. Actually, some of the guidelines, some of them, there are no age limits. There are saying 17 or 18 as a start, while at the end, there is no age limit now in some of the guidelines. But if someone wants to donate blood and it is the first time, it should be younger than 65 years. While if he donated previously, 65, 70, here even we accepted blood donors who was 80 years old. We accepted Dr. Fariad Hawezi, he donated here 2 or 3 times here. And he said that there is no age limit for blood donation. In some of the guidelines, actually, it is written 63 or 65, but in some of them, there is no age limit. And then, as Dr. Shirwan mentioned, the blood of a young person and a person who is 65 or 70 years have the same value and the same benefit to the recipient. Thank you very much.
Thank you very much, Dr. Hunar. Who else, please? If you have any questions also, yes, Dr. Aryan, please.
Yeah, Doctor, in our groups, most of the participants agree with encouraging and motivating the people around us to donating.
Dr. Aryan, يارا إنترنتي قطع أبو. Dr. Aryan. Okay, until she return back. Who else have any question from our presenter? Anything? Can raise your hand. Until Dr. Aryan return back, I have a question. I don't know which presenter can answer me. دکتر فرقی کلاشاخه نزانم چی پدرم به انگلیزی
کاپینگ
کاپینگ
من هر حجامه به انگلیزی شهر نسم
حجامه ببینم نداده. It is replacing with the blood donation. Both of them is the same or it is different?
You want me to answer, Doctor?
Yes, please. Which because some women or people say hijama it's different with the blood donation, and I would like to know which of them. If blood donation is the same as hijama, so why I don't give blood to save the life of people too?
In my opinion, I don't know what is the scientific base, but in my opinion, as a benefit to the donor or to the person who is donating blood or making hijama or cupping, the benefit, I think they are the same. Because it is an amount of blood drawn from the body. Okay? Yes. It is wasting of the blood when someone goes for hijama, but the same amount of blood is used to save lives of another person or more than one person, one patient. But because our Prophet said that it is a sunnah, we cannot say it is harmful or it is not good. I'm usually saying if you are fit for blood donation, go for blood donation. And if you are not fit for blood donation and you have high level of hemoglobin, please go for hijama.
Yes.
Why you are wasting our resources? Don't waste our resources in blood bags, in laboratory test kits and staff efforts. You have high level of hemoglobin and you are not fit for example, hepatitis carrier, a person who is positive for one of the markers, or have some other restrictions of blood donation, but he has high level of hemoglobin, wants to donate. We are not accepting him or her as a blood donor, and I am advising him or her, please go to copy blood of hijab. It will be better for you, and we will keep our resources for other blood donors.
So those people who are contraindicated for blood donation, they can go to hijama, and those who are healthy can give blood.
Of course. Yes, of course. Dr. Shivan mentioned some point about polycythemia vera. Polycythemia vera, they need therapeutic venesection. So you have to draw blood from them, but you cannot use this blood for transfusion.
For transfusion, yes.
Thank you. It is the same. It is the same. But when you are drawing blood in the blood bank, you are wasting your resources.
Thank you very much. I get my answer. Please, Dr. Delir, فرمو.
Okay, thanks again, Doctora. Regarding my group 3,
yes,
Dr. Afrah and Dr. Talar asking about the facilities for blood donation. Even they have fearing for blood donation, but lastly, they asked about the facilities for blood donation, even providing them phone number or facility for I mean by السرة يعني قصدي والسرة نبيتن لبو يعني زوريان they have no sufficient time or time for going to the center. Okay.
sorry
أما زال خير شيء blood donation in
okay. ما بس أويا بخير هاتنا كي جرميان لبكم كاتي خينوالي.
نا قصدي هوني أنا دكتور عفوا
آسانكاريان لبكم هي شكرا بله
بس يوك كقولتي لو أنا سر وشتواه بيتن دكتور أفراح قلت الناس سر زحمتها بيتن قالهاش بيتن لو أنا آسانكاري تانو دكين تايبت لو ظروفك باسي كورونا ذكرتن سعركش منطقية طبعا. هرچەندەم باسی ئەوم کرد کە گوتم لە سنتەر ئەکیت لە بەڕێوەبەلاتی برین بانکی خوێن ئاسانکاری و ئەو ئیزراتانە کرایە باعتیبار لە بۆ زروفی کۆرۆناش کرایە. دکتۆرە تەلار باسی ئەوەی کرد کە پارەیەکی ڕەمزی نەک لە خودی با بڵێن ئەو کاوە بگیرێت پارەیەکی ڕەمزی تەخسیس بکرێتن لە بۆ تەنانەت ئەو کەسانی کە لە مارەوە خوێن دەبەخشن تیم هەبی بستە دویان وا باشترە. هەرچەندە نازانم تا چەند ڕێی دەچی لەبەر دیسئینفێکتان توشتی وایە ینی زروفی تاقیم و ئەو پرسیاری ئەویان هەبوو. زۆربەی پرسیارەکان هەر لەسەر ترس بوو ڕاستی، بەڵام لە کۆتاییدا خۆشبەختانە کە کاریگەری ئەو سیمپۆزیۆمەیان لەسەر هەبوو کە گوتیە قەناعەتیان هاتیە کە ئەو ترسیان لەسەر نەمایە. دووبارە دەستخۆش لۆ ئێوە و لۆ ئەندامانی گروپەکەش.
ممنون سپاس. الحمد لله. فرمو دكتور هنا الرواب زانم جنابت ولا عم بدي واشتان.
بالنسبة فاسيليتي يعني ويكا كي يشتم كان بمواعيد في شتيك وامانية بداخل يعني تايستا ويكا بيو دونيشن كابي خوي شخصي حاضر بيليرا بيت ولا من هاتم بو دونيشن يعني شكا براستي او عددي من روجي 150 حتى 200 اس دي تي ار كونترول كدني بواسطه تلفون مشتوى عندك زحمته خلق ببي كاتي خوي دير بخير بخش يعني ببي وقتي كدسي بطاله يعني اگر خوي بخير بخش يعني شغل ناچار كده بداوي لك كادو ريبليسمنت او وقت لو اني واصل شيء خوي بيت بخير بخش فما حتى استعرب لبر نبوني انفورميشن سيستم مانجمنت انفورميشن سيستم داتابيس كمانجمنت يعيش على المكالمات شش خلق صار خليجي او موضوعين حتى استا بوم نكراو استا موافقات من ورقت ولا عليه صار كيف بتشت هذا وقت او خلق الرقم التلفوني يبي او خلق او كات ابلكيشن مثلا موبايل بيت وانا خلق الابلكيشن كو موعد ورقه بوم الدونيشن بس حتى ام دقيقه شتي شو ماني كدونيشن كابي خوي بيت يرم او وقت تر خوي شانسي خوي خربال غو كاتي كهاتو يعني شغله بجوري ظروفك او دقيقه موجوده اتوانيتو او كاريب كياري شيشلوكي حالات كتير معناها كبجروب بين بوخنا بخشين اما اتوين او جروب ما عمليه تجاوز يعني اوكي شو كان او انتو سريعه التيابو قرشوا يشاندو تايبت بوزياب كينو ويكا شو كان سريعه المراز والتاخير بالنسبه لقربالغي وقت هي والله وقت شيء يعني قربالغ هاف وش نازاني شيء قومي طبيعتي ملتي ما يعني تبقى اما زورنون نموذجيات نفسه شيء مهم يعني لا والله جاري وهي قربالغ غالبا كورونا لا ايش انا قبل استدير هي صراحه هو واقعك لا مش بالنسبه او اقتراحي فكره وكواحد دونر باري كرمزي مودا بدري طبعا او قد فكره عالميا او موضوع بلا دونرنا بهيج مقابل او شخصي كخير بخشيت كز مقابلي بخشين هيك ورناقري تو باريك لباري خود بخشي بو خلقي فقير او مقابل
دكتور بالنسبه او برا باري قصد او نبو او برسيارش ككلا قصدي او بو وكو صندوق دعم هبيت لبو مصرفي او تيمي كدسته وشوينا لە پارەکە دەبوو نە دۆنەرە نە لە بۆ ڕسیپینت قەزمان ئەوە نییە لێرە لەو حالەتە لە بۆ تیمەکە بیتن ئەو سندوق دەعمە لەلایەن حکوومەتەوە دەبی لەلایەن خێرخوازەوە دەبی لەو حالەتانە نانا نهاییان باسیەوە نەکرا ببوورە نە لە بۆ دۆنەر نە لە بۆ ڕسیپینت باسی
تەواو واضح نەبوو
دیارە سیفەهم
ئێستا واضحا بووبوورە داوای لەبوو نەکەم ئەوە ئیشی کارمەندانی کەرتی تەندروستێکە لە وڵات بانکی شەکەن ینی کارمەندانیش حقیقەتەن دۆ مەعاش وەرەگرێ ئەو کەسە ئیشی ئەوەیە بایبەت تیمان هەیە بۆ دەرچوون و هەموو وەختێک پێشتر بەڵام ئەو ساڵنیە بەواسطەی زۆرۆکی کۆڕۆنا نەمانتوانێت بیش دەرچوونێکوانە بن بەرەوە ئەوەی کە لە کولیات لە مەعهەدەکان حتا لە داوای حتا لە ناو خودی پارلەمان مەسەلەن لە بارگای حیزبەکان بۆ هەموو شوێنەکانە بە دەرچوومان هەموو بارگای پێشمەرگای زیێرەبانی هەموو ئەو شوێنانەی بە ساڵانە دەرچوومان هەبوو بە بەرنامە بەڵام بەواسطەی کۆڕۆنا و لەبەرەوەی دروستنەکردنی قەرەباڵەکەدا لێ بۆ لە ساڵی یەکەم شتانەماڕاگرتووە ئێستا ئەمڕۆ دەستمان پێکردەوە بۆ چوونە ماڵەوە هەندێک زەحمەتە لەبەرەوەی هەندێک پێداوێتی تایبەتت دەوێت بۆ خوێندبەخشی تۆ زەحمەتە ئەو شتان ببیتە هەموو ماڵێکەوە بەڵام ئێمە سیارەیەکی تایبەتمانەیە کە چوار بێدی تایبەتی تایە و شریکەری تایە و هەموو سەرزەماتێکی تایە وەکو وایە قاعەیە بێنەوە بانکی خوێن بەڵام لەسەر سیارەیەکە و ئەجوڵەی ئەڕوا تیمی خۆمان لەگەڵ ئەو سیارەیە دەرەچێت بۆ هەر شوێنێک بمانێت توانین بیبین شار و شارێک توانین بیگەڕێنی کێشەیەکی نییە بەو شێوەیە هەر شوێنێک ئێستا وەکو کولیە وەکو مەعهەد وەکو دایرە یان وەکو گروپ هەر کەسێک حەزی لێ بێ لە شوێنەکەی خۆی هەڵمەتی شوێنەخشی بۆ ستافی بۆ کارمەندی شەریکیە مۆڵە هەرچیەکە بکات ئەتوانین تەنسیق لەگەڵ ئێمە بکایەوە مەوعیدی بۆ دامین تەنسیقی لەگەڵەکەین تاریخەکەی بۆ تەسبیع دەکەین فڵان ڕۆژکاکە ئێمە دێنە ئەو شوێنە ئەوەتی خوێنبەخشیتان بۆ ئەنجامەکەی چەند کەس لێ خوێنبەخشێت ئەتوانێت خوێنبەخشێت بەنسبەتی پارەشتیوە خۆزگە وەکوی زۆر باسی کرد بودجەیەکی تایبەت هەبوایە بە مەسائلی بانکی خوێن و دۆنیشن و ترانسفیوژن لێدەسن بەداخەوە لەلایەنی جیهاتی پەیوەندیداریشەوە کە وەزارەتە بەرزترە یان هەر شوێنێکی ترە بودجەیەک تایبەت نەکراوە بە خزمەتگوزاری گواستنەوەی خوێن بودجە ئێمە لەسەر کەرتی تەندروستی گشتیەکە کە بەشی هیچ شتێک ناکات بەڕاستی لە هەموو دنیا مەسەلەی ترانسفیوژن سێرڤیس جیاوازە هیچ پەیوەندیەکی بە کەرتێکی تەندروستی تایبەتەوە نییە بە تەنیا بۆ خۆی ئۆرگەنایزیشنێکە بە تەنیا بۆ خۆی لە بودجەی ساڵانی ئەو وڵاتەوە بودجەیەکی تایبەتی دانرێت بۆ خزمەتگوزاری گواستنەوەی خوێن بەس بەداخەوە لای ئێمە هەتا ئێستا شتکڕینەکانمان ڕابط کراوە بە بەشی تاقیبەکانی ناو دایرەی سەحەوە یعنی ئێمە سەلاحەتی ئەوەمان نییە کتێک کە بۆ ئێمە پێویستە بە دڵی خۆمان بکەین ئەم دەقیقەیە پێشتر هەمان بوو دوای هەموو سەلاحەتەکان وەرگرتوکردن بە مرکزی یعنی ئێمە دەناوێنین بە دەستدابینکردنی مواد و پێداویستی ڕۆژانە بەدەست تیوبەوە بە دەستدابینکردنی موادی شتینی ڤایرۆساتەوە ماوەیەک ناڵاندمان بەدەست نەبوونی کیسی خوێنەوە یعنی بە تۆ کیسی خوێنت نەبێت هەزار وڵات دۆنەر ژەبە دەرگاکەت ڕاوەستێت و ناتوانیت چی ئەوە معاناتمان لە مەسائلی بەجێت و فاینانشیەڵەوە زۆرە هیوادارین لە ڕێی ئەم سیمپۆزیەمەوە خەڵکێک هەبێ جۆی ئێمان بێ و دەرمان بگەێنێ شتەکە بەڕاستی ئەرکێکی زۆر گەورەیە خزمەتێکی زۆر گەورەیە زاڕوەتێکی زۆرە بۆ هەموو کەرتی تەندروستی لە پرزنتیشنەکە باسم کرد ئەگەر کەسێک باوەڕ ناکات با یەک ڕۆژ ئیشی وڵات بانک ڕاوەستێ زانە هەموو خستەخانەکانی هەولێر ڕاوەستن لە ڕاوەستن هەر لە شتەرگەریەک لە سنتەری دڵەکرێ 15 یەکەی خوێن بۆ هەر نەخۆشێک داوات ئێمە ڕۆژانە 6 خوێنەوە بە سنتەری دڵەچێت ڕۆژانە 6 خوێنە بۆ سەلەسیمیا چێ ڕۆژانە 50 خوێن بەس RBC بێ لەوەریتر بۆ خستخاینانەکەلیە چێ ئەمانە هەر هەموویە بێ ڕاوەستێ ئەگەر بۆ ڕاوەستی جایتر کارە چاتەکە تصور کەن یانی ئەگەر نەبێت
دەستخۆشکردنەوەکت کاکتەر
زۆر سپاس دکتۆر هونەر و باشە خەڵکیش ئەو معاناتە بزانی و قیمەتی کاروباری ئێوە و ئەو پێداویستیەکانی کە پێویستە بۆ بلاد دۆنیشن هەبیت وەکو جنابەت باست کرد با 1000 دۆنەر هەبیت بەڵام کە فەسیلیتی نەبیت بەکاربهێنی هەر باشە بەنسبەت ساڵانی ڕابردوو ئەوەشمان نەبوو دەستان خۆش بی بۆ ئەو دامەزراندنی و بەرەبەتی کە ئێستا لە بەردەستانە و ئەو کارە پیرۆزەی کە دەیکەن دەستان خۆش بی کەسی تر هەیە پرسیاری هەبیت یان سەرنجێک یان کۆمنتێک ئەگەر نە کۆتایی بە سەمپۆزیۆمی خۆمان دەینین بەڕاستی دەستخۆشی دەکەم لە هەموو ئەو بەڕێزانەی کە لێرەنە و بە تایبەت ئەوانەی کە قبولیان کرد دکتۆر هونەر دکتۆر نەوشیروان دکتۆر ڕۆناک دکتۆر ڕزگار سۆری دکتۆر ئاریان دکتۆر تاوگە دکتۆر دلێر و سپاس بۆ ئامادەبوونی دکتۆر ڤیان سلەیمان و هەروەها دکتۆر خانزاد لە کوردستان وومن یونیۆن و لەگەل ئەنجومەنی بالای کاروباری خانمان لە حکوومەتی هەرێمی کوردستان زۆر سپاس بۆ هەموو بەڕێزان سپاس بۆ بەشداربووان سپاس بۆ ئەوانەی کە سەرنج و پرسیاریان هەبوو بەڕاستی من خۆشحاڵ بووم کە هەست دەکەم توانیمان پێکەوە هەنگاوێک بنین بۆ ئەوەی کە بتوانین ئافرەتانی ئێمە زیاتر ڕۆڵ ببینن لە بەخشینی خوێنی خۆیان و ڕزگارکردنی ژیانی خەڵکی تر و هەروەها وەکو ئەنجامدانی توێژینەوە بە تایبەت بۆ ئێمە مامۆستایانی زانکۆ کە پێویستە چەندین توێژینەوە ئەنجام بدەین زۆر 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 سپاسێکی تایبەتیش بۆ دکتۆر هونەر دەکەم کە وەختی خۆی دا بە ئێمە لەگەڵمان بوو ئەمڕۆ دەستی هەموو لایەکتان خۆش بی و هیوادارم ساح و سەلامەت بن ئینشاءالله سەرتیفیکیشنەکانتان لە ڕێگای ئەو گوگل فۆرمە کە پرتان کردووە بەناوی ئێوە دروست دەکرێت و بۆ ئیمیلەکانتان ڕەوانە دەکرێت ئەگەر هەریش بەدەستان نەگەیشت پاش و 2 یان 3 هەفتە دەتوانن ئیتیسالمان پێ بکەن و داوای سەرتیفیکیشنی خۆتان بکەن خواتان لەگەڵ بێ گەلێک مەمنون سپاس خوا هەموو لایەکتان بپارێزێت
دەست خۆش بکەوە سەرچاو
بەرچاو خۆ حافیز
دەستی هەموو لایەک خۆش خوا حافیز هەموو لایەک
خواحافظ